Hello, my name is David Stocker, and if you would, please lend me a few minutes of your time to talk about the American Health Care Act, or AHCA. There's a shorter version of this video down in the show notes below. If you don't have time to watch the full version here, you can go there first, catch the quick 1-minute version, and then come back to this later on. My Congressman, Tom MacArthur, the 3rd District in New Jersey, was the one who was responsible for bringing the AHCA back off of ice and helping get it through the House with the so-called MacArthur Amendment. Universally acceptable, affordable health care that's also effective is just part of what you have to have in any first world country in the 21st century. Unfortunately, the AHCA is not a first world healthcare solution. It's so bad that in the original draft of the MacArthur Amendment, he tried to exempt congressmen and their staff from being affected by their own bill. It's good enough for the American people, but apparently not good enough for Congress. They only relented and got rid of that language after there was an uproar about it. Prior to joining Congress, Tom MacArthur's previous career was in insurance. He's an old insurance guy. The real pity here is he could have used his experience in the insurance industry to design a system that was simple, efficient, effective, and worked for all Americans. Instead, he chose to give a $700 billion tax cut to the absolute wealthiest Americans and pay for it by throwing 22 million people off of their health insurance. So what makes it such a bad bill? For starters, the Congressional Budget Office estimates that 1/6 of Americans live in healthcare markets that would be rendered unstable under the AHCA. And at least 22 million would lose their insurance. It also eliminates pre-existing conditions protections. So if you're going to get cancer, you better get it now, because a couple years from now you may not get health care. Anti-age discrimination protections will be gone. This means that people over 50 may find that their health insurance becomes unaffordable. And for most Americans, it'll increase deductibles and reduce coverage, or both at the same time, meaning that you'll be paying more for less. It also allows states to decide that they want to reduce the so-called essential health benefits, or EHBs, in their markets. This means that what's covered by insurance will also be cut in many states in the US. So deductibles will rise, premiums will rise, and the EHBs get cut. Many people, especially low-income people, will find that they can no longer afford health insurance, and they'll be priced out of the market. If people are priced out of the market, especially younger, healthier people, who normally are the ones who are paying for the older, sicker ones in health insurance, then only the old and the sick are left in the markets, the people who are desperate, who need to have insurance right now because it covers them. If those are the only people being covered, the markets go into a death spiral. And if you have employer insurance and you think you're safe, think again. Because if the essential health benefits get reduced, this means that your insurance will also cover less. According to a survey by Families USA, chronically ill patients who are covered by health insurance from their employer are 40% less likely to seek a new job than people who are not in similar situations. This means no career changes, or potentially not taking that job offer that includes a promotion. So the effect is to distort the labor market and depress wages across the board. So you end up paying twice. First in lost wages, secondly in more expensive health insurance. And by reducing the individual mandate and encouraging low income and young people to not have insurance in the first place, they'll destroy how insurance is supposed to work in the first place. If you don't need insurance right now, then you're paying for the people who do need insurance right now. And don't worry, your turn will come. You'll need that health insurance one day. And when you do, you'll be thankful that it's there. And if by some chance you never need it and you live your entire life without ever having to go to a hospital or getting seriously ill, well, then you should count your blessings. Because the people who are sick and do need that health insurance right now, they would love to trade places with you if you're healthy. MacArthur's an insurance guy. He knows this. So if it's not a healthcare solution for a first world nation, what is it? Well, what it really is a tax break for MacArthur and his country club donator cronies. Rather than fixing the problems in the ACA and making it better and making it work like it should, they prefer to just monkey around and make it worse. It's time you upgrade your congressman. Next time I'll talk about solutions for simplifying, streamlining, and making health insurance work right. Thank you for watching. Please subscribe to my YouTube channel. Share this video on social media, tweet it, retweet it, but most of all, thank you for watching.